In this recording, we are going to go a bit deeper into cellular adaptation. We're going to talk about the types of injuries that cells face and talk more about how the injury specifically affects the cell. Before we get into the causes of cell injury, let's take a minute and just generally look at the effects of cell injury. When a normal cell is stressed, it will try to adapt. And if it's successful, the cellular injury would be considered reversible and it would eventually return to its normal state. If the adaptation is not successful, then the cell injury would be considered irreversible and would result in cell death. There are two ways for cells to die. Injured cells can be eliminated by apoptosis, followed by programmed cell removal, or the cell will rupture and die, resulting in necrosis. Later in this presentation, we'll talk more in depth about apoptosis and necrosis. But first, let's talk about several ways that cells might be injured. There are 5 basic types of agents that can injure cells. First of all, physical processes, then radiation, chemicals, biologic agents, and nutritional imbalances. Let's talk about each one of these a little more specifically. Some examples of physical injury include trauma, like crushing your finger in a car door, or a cut, or even a gunshot wound. Trauma directly damages the cells, but it also damages tissue around the injury. Extremes in heat actually cause coagulation of blood and of proteins and can also break cell membranes. Extreme cold causes blood vessels to constrict. This can decrease the oxygen delivery to the tissue and result in hypoxic injury. Extreme cold also increases the blood's viscosity or its thickness and can even form ice crystals, as in frostbite. Ultimately, all of these injuries make the capillaries more permeable, and we'll talk about capillary permeability a lot in future chapters. But just know for now that it makes it easier for fluid to enter the cell when the membrane is more permeable, and that results in tissue edema. Electrical burns occur when the tissue provides the resistance to conduction. So when people are electrocuted, they'll experience burns at the entrance and the exit sites of the electricity. And if the electrical current travels through the heart, then the electrical activity of the heart may be interrupted. Radiation. It can be low frequency and non-ionizing, kind of like your cell phone signal, or it could be higher frequency and ionizing. Ionizing simply means that the photons have enough energy to knock electrons off of atoms and molecules. Sunburn is a type of radiation injury. A protective cellular adaptation would be the release of melanin, which helps to protect your skin from the ultraviolet radiation. Ionizing radiation releases free radicals, and those free radicals destroy cells. And it happens to be particularly effective at destroying cells that divide very rapidly. And rapid cellular division is a feature of cancer cells. So this is why radiation is one of the tools that's used to treat cancer. Cell injury also occurs with chemicals or from biological sources. In pharmacology, we're going to learn a lot about many chemicals that disrupt cellular processes and can lead to cell death. Chemotherapy is a great example of chemicals that damages cells and hopefully damages more cancer cells than normal cells. Lead and mercury are two chemicals in our environment that can build up and injure cells. This happens specifically by interfering with the cell's ability to make proteins. The main risk of too much mercury and even too much lead is that the levels are damaging to brain tissue. Lead poisoning has been in the news for several years because of its devastating effects, particularly in children. Lead has been associated with neurobehavioral and cognitive deficits in kids. It also causes anemia. Lead is stored in bone tissue, and bone turns over very slowly, so it can take months or even years to reduce high lead levels. Although lead-based paint has been banned for several years now, it is still present in millions of homes. Flaking paint or playing in soil that has been contaminated with lead are the most common risk factors for lead toxicity in children. Most at-risk adults have occupational exposures. For example, the obvious exposures would be associated with lead mining, manufacturing, or refining. But also think about artists who are using types of lead-based paint perhaps, those who work in auto body repair, battery manufacturing, bridge reconstruction because they're working around a lot of old paint, and other construction workers, just to name a few occupational hazards. Talking about biological injurious agents usually brings to mind viruses and bacteria. And these are different from chemicals because they can replicate and continue to threaten cells in lots of different ways. Parasites also fit the biologic category, but most commonly we do think of viruses and bacteria. Viruses can upload themselves into host DNA, resulting in lots of different symptoms. Bacteria produce endotoxins or exotoxins that interrupt protein synthesis. This slide depicts the three major mechanisms of cell injury: the formation of free radicals, hypoxia and ischemia, and problems with calcium regulation. In the first column, the free radicals with their unpaired electron cause oxidation of cell structures, and they can also alter cell DNA. In the middle column, you can see that hypoxia and ischemia trigger anaerobic metabolism, and that directly inhibits the mitochondria's ability to make ATP. And in the last column, when intracellular calcium increases, many cellular processes are disrupted, and that also would include ATP production. And as we move down the diagram, we see that when ATP is in short supply, the sodium-potassium ATPase pump does not work well, and this results in increased intracellular sodium and, because of osmosis, an increase in intracellular water. Without oxygen, cells resort to anaerobic metabolism. This decreases glycogen stores and also lowers the intracellular pH. When calcium homeostasis is disrupted, ribosomes are detached, cells can't make proteins, and they can't deposit lipids. This is an important slide for you to know and understand. Free radicals have an unpaired electron in the outer shell. and this makes the molecule extremely unstable, with a tendency to react to normal cell components. Reactive oxygen species are oxygen-containing molecules that also include free radicals. Although normal body processes produce reactive oxygen species, there are outside causes like ionizing and ultraviolet radiation that can cause too much reactive oxygen species to be produced. Cell damage occurs when free radicals steal electrons from the lipids in cell membranes. If a cell membrane is no longer intact, then intracellular proteins are modified and DNA can be damaged. Again, normally our cells can get rid of free radicals that are produced by normal body processes. For example, superoxide is a free radical that is constantly produced by the mitochondria when we make ATP. And we also make a protein called superoxide dismutase, and that is the detoxifier for superoxide. In certain forms of ALS, which is Lou Gehrig's disease, this enzyme doesn't work properly. Taking in plenty of antioxidants can help by providing the extra electron that we need, or by breaking down the free radical molecule. However, when outside influences increase free radicals, as is the case with ionizing and ultraviolet radiation, then the production of reactive oxygen species exceeds the body's ability to neutralize and eliminate it. And we call this buildup of reactive oxygen species oxidative stress. Cells can become hypoxic from decreased blood flow to tissues or hypoxia by a shortage of oxygen in the air, by respiratory disease that blocks the ability for oxygen to reach or diffuse across the capillary membranes. Without oxygen, there's no ATP production. And as we talked about a few slides back, no oxygen to the cells means no ATP, and without ATP, we can't power the sodium-potassium pump. When the sodium-potassium ATPase pump stops, then there's an increase in intracellular sodium, and due to osmosis, water follows sodium into the cell. At the same time, the cell is operating anaerobically, and we've talked about anaerobic metabolism using glycolysis, and the byproduct of glycolysis is lactic acid. And then lactic acid damages cell membranes and ultimately the DNA, and inhibits the cell's ability to produce protein. Without ATP, we don't have enzyme reactions and the cell can't perform properly. Water and lactic acid builds up, and within minutes, we can have irreversible cell damage. For brain cells, this can happen in 4 to 6 minutes. The term hydropic degeneration literally means cloudy swelling. This figure provides another look at the way cells react to hypoxia. It's just a different way to depict this process we're talking about. So when cells are deprived of oxygen, you can see that the ATP production decreases. The cells try to maintain homeostasis, and in this case, a large portion of the cell's energy is spent trying to maintain the ionic gradient, trying to keep the sodium where it's supposed to be and trying to keep the potassium where it's supposed to be. Eventually, sodium moves into the cell, potassium moves out. Water tends to follow the sodium, again because of osmosis. Remember, intracellular calcium should be low, But when the ions are in flux, calcium also enters the cell. That causes a release of intracellular and nuclear enzymes, and this further exacerbates the intracellular swelling, and we expect this to ultimately result in cell death. So it seems logical, if we could restore the blood supply to the oxygen-deprived areas, we could prevent cell death. And this is true to a point. However, when cells have been starved of oxygen, they can't produce antioxidants. Restoring blood flow creates this oxygen-rich environment, and in some ways having oxygen is an improvement. However, with the oxygen come reactive oxygen species. Without antioxidants, the cells can't protect themselves from reactive oxygen species. Also, reperfusion brings inflammatory cells, which can extend the area of infarct or the area of cell death. Reperfusion injury is commonly seen in patients with myocardial infarctions or heart attacks and cerebral infarctions or strokes. In the case of heart attack or myocardial infarction, the ionic imbalances, the potassium and the sodium shifts, also place the patient at risk for serious disturbances in their heart rhythm. Cell injury results in impaired calcium homeostasis, and we've talked a lot about this. The cells usually maintain the extremely low calcium levels within the intracellular fluids compared to extracellular. The cell needs ATP to maintain the calcium balance. During injury, calcium moves into the cell, and more calcium is released from the intracellular stores. Calcium acts on several enzymes that can have damaging effects on the cell. Increased intracellular calcium also causes muscle contractions and can, since the heart is a muscle, we could expect abnormal intracellular calcium levels to alter the heart rate. Calcium also triggers neurons to release neurotransmitters. Bottom line, the cell needs tightly regulated calcium balance to survive. If a cell has been damaged irreversibly, cell destruction and removal happens in one of two ways. Apoptosis is also known as programmed cell death. Apoptosis eliminates injured and damaged cells. This helps to keep the damaged cells from replicating, and the immune system is primarily responsible for triggering apoptosis, particularly in infection. By contrast, when cell walls are injured, then cells will rupture and die a necrotic death. When cells swell, rupture, and spill their intracellular contents, an inflammatory response is triggered. And we're going to talk quite a bit more about the inflammatory response in subsequent chapters. When a cell dies as a result of apoptosis, the important point is that the dead cell doesn't injure cells around it. Apoptosis can be triggered from either an intrinsic pathway, likely because of a malfunctioning mitochondria, or it may be triggered from a signal outside the cell. But ultimately, both the intrinsic and extrinsic pathways turn on the Kpase family of intracellular enzymes. As a result, the cell undergoes fragmentation of the nucleus and the DNA, autodigestion of cell proteins, and then the cell fragments are ultimately phagocytized by macrophages. So as you can see, apoptosis is a pretty nice, neat little process. In necrosis, However, the cell membrane breaks, and spilling the cell contents serves to trigger the inflammatory response. Necrosis interferes with cell replacement and with tissue regeneration. The mechanism for necrosis varies depending on the type of the tissue and the type of injury. In death by necrosis, the cell will die in one of three ways: by liquefaction, coagulation, or caseous necrosis. In liquefaction, the middle of an ischemic region softens and its contents are discharged. Liquefaction is common in brain tissue after injury, and this image is a picture of liquefaction of a brain lesion. In coagulation necrosis, the pH drops, acidosis develops, and inactivates the enzymatic and structural proteins of the cell. Coagulation necrosis happens in areas where tissues die from lack of blood supply. This is called an infarction. This image demonstrates coagulation necrosis in cardiac muscle tissue after the muscle has been without oxygen for a period of time. In caseous necrosis, the dead cells persist indefinitely. Thought to be part of the immune response, the body produces a wall around the dead cells or the necrotic area. The walled-off region is called a granuloma. Caseous necrosis is common in tuberculosis. The term caseous is actually Latin for cheese, and the inside of the granuloma has a thick, cheesy appearance. Gangrene is a large area of necrotic tissue. Both dry and wet gangrene are caused by circulatory issues, and that makes the tissue at higher risk for a secondary infection. Keep in mind that these lesions are caused by poor arterial blood supply. Secondary infections are common, yes, but the tissue and the skin changes that you see are caused from ischemia, not from infection. In wet gangrene, there's a problem with venous flow from the distal tissues. The injured cells tend to swell and eventually liquefy. This swollen, moist tissue makes infection even more likely in wet gangrene compared to dry gangrene, although it can happen in both. By contrast, in dry gangrene, the venous drainage is intact. There's no problem with venous flow away from those toes that are black and dry looking. All gangrenes lead to necrotic cell death. This is a really good slide to know.